Hi ladies, so I am 22 weeks and 1 day pregnant today. So I wanted to go ahead and have my appointment yesterday so I could let you know kind of what was going on with that. So yeah, 22 weeks and I have my list here and then I have some things to show you. So last week I had, so this is my third pregnancy, so like around my belly button, it's not completely together. So there's a little gap, and the baby kept kicking right in that spot. And so if I or my husband put our stomach or our hand on my belly, we could feel like feet and hands and like elbows and parts of the baby. It was really weird, but kind of cool because you usually don't get to feel the baby from the outside like that. Um, also this past week I've had a lot of lower back pain, and it's led me to sleep funny, which has given me other back pain. But like right around my coccyx and sacrum on the left side, it feels like there's a pinched nerve. I don't know if it's sciatica because I really haven't dealt with that in other pregnancies. It's not a shooting pain down my leg. It's like a I can't move pain. Like it hurts a lot when it hurts. And then I sleep and I wake up and it's all right. And I notice if I lean back, like especially in the bathtub, when I get out, that's when it starts hurting. So I don't know exactly what the trigger is, but I'm guessing it's positional and it has to do with nerves. And I have a theory, but I'll tell you about that when I get into telling you something else. So I'm going to tell you a couple things that happened in the past day, which technically should go in next week's vlog, but I'm just going to go ahead and tell you because I said I would. So I had my ultrasound yesterday to check on the baby's kidneys and heart and position and things like that. If you haven't been watching my vlogs, the baby's kidneys were dilated at my anatomy scan. And it's a soft marker for Down syndrome, so on top of it being a problem in and of itself of the kidneys being dilated, it brings up worries about, if the baby might have a chromosomal problem as well. And so my kids are being a little loud, I'm sorry. So anyways, we had the scan, and my OB was actually, she had 2 women in labor, so she was at the hospital. She wasn't at the office. But the ultrasound tech there is pretty good about answering questions, and although she can't say anything final, we were able to talk with her about what they were seeing and things like that. And my mom went with me because my husband was sleeping from work, and I took my kids to my in-laws' house, so my mom came with me. So the baby's kidneys, and I need to ask, my doctor's going to call me today after she reads the ultrasound. But I'm not sure what they were measuring at my anatomy scan. But one of them is 6 millimeters and the other is slightly under 6 millimeters. And normal, I've read normal is 4, but apparently, like, what all this ultrasound techs are taught and what kind of the standard is, I guess, is 5. Anything over 5 is concerning. So one is like a little over 5 and one is about 6. So it's mild dilation at this point. I don't know if it will change or if it did change since last time. Can't imagine there would be too much change in 2 weeks if it's only the largest one's at 6 now. And then I've heard it can go up to 10, and that's when they get more worried. And then I've heard 12, and I've heard higher numbers too. But 10 would be, I guess, the beginning of severe. So at this point, they're mildly dilated. So what it means is unknown at this point. It could resolve itself. The baby may have to be on antibiotics when it's born to prevent kidney infections until the baby grows a little and the tubes to the kidneys can grow. There could be a blockage in part of the kidney. The baby might need surgery to fix a blockage if there is one. And interestingly enough, one of my husband's cousins just had a baby late in 2014, like December, I think, who had dilated kidneys and had to have surgery shortly after birth. So someone in our family just went through this. As I did ask if there were any other markers for Down syndrome, because obviously that is a concern of mine. And she said she couldn't say, like, she said she wasn't seeing anything, but the doctor was going to have to read the ultrasound. And some of the things with, like, leg bone length and stuff like that wouldn't typically measure different until, like, 30 weeks or later. So some of the markers they look for wouldn't have shown up yet. So it's kind of just like we're just waiting now. There's not much we can do at this point. Good news from the ultrasound is the baby did flip head down, so baby is not breech anymore, and I think that's where all the back pain's coming from, because my pelvis and sacrum and coccyx and everything wasn't used to having a baby's head pushing on it all, and so the baby flipped head down, and so now there's pressure on all of those bones and nerves, and I think that's probably while my body kind of adjusts to having the baby head down. I think that's what the pain is coming from. The baby weighs 1 pound, and they were able to get a good look at the heart, and the ultrasound tech said she thought everything looked good with the heart, but again, I'm waiting to hear from my OB to give the final word on that. So yeah, that's kind of the result of the ultrasound. Okay, so I kind of make a list of things I want to get done each week regarding the pregnancy. Last week I really worked on the baby's room, and I'm going to do a tour of that sometime soon-ish. I'm sorry for all the beeping and buzzing. It's just what happens when I'm in my office. So anyways, yeah, I worked on the baby's room. I will do a tour. I'm waiting for a crib skirt that I ordered that isn't going to be here till May, so I may do the tour before then because that's a long time to wait when I have everything else ready. And then this week, because it's Tuesday now, my goal was to research how to get the breast pump through insurance and start that process of replacing. I have a breast pump, it's back there. I used it with both of the kids, and I would say after using it with 2 kids, that's probably enough. Like, it's kind of lost some suction and stuff, and since I can get one covered through insurance, that's what I'm going to do. So if anybody's curious about the process of that, I did order mine today, and so what I had to do was call my insurance and ask them who they work with to provide breast pumps. And so they gave me a list of 3 companies, and then I could go online and see what was available to me. And then after I did that, then they said, my insurance company said I had to call and order it. So I did, but every one of the sites had like a fill in the blank order form. But I called because my insurance company said that's how I had to do it. I don't know why I had to do it that way, but I did. So I called, and you have to be ready to order when you call. You can ask questions, I guess, but if you're going to order, you need to know your doctor's name, address, phone number, fax, your address, the pump you want to order. So you need to go to the sites ahead of time and see which pumps are offered, and then you also need to know their phone number and fax, street address for your OB. And then what they do is they like contact your OB to get like a script for the pump, and then they contact your insurance, and your insurance has to say what they will cover. I'm not sure if there's a standard amount. My insurance covers up to $150. I don't know if some of the pumps are cheaper and some are more expensive. And then I know the company I went with, they have like optional, like additional things you can order. So I went ahead and ordered the Medela Pump In Style because that's what I had, and so I have all of the accessories that go with that pump. There are some other pumps I'm kind of interested in trying, but I have all the accessories for that one, so that's what I went with. And my insurance actually covers 2 pumps a year, so I'm thinking around the 6-month mark I may try one of the other pumps because I just feel like around a year pumping, sometimes I don't respond as well to a pump, so it may be good to change things up. And then as a doula, it'll give me insight into some other kind of pump, so I can say from personal experience how the pump was. So for other women who ask, and I can probably even review on here the differences between the two, since it's covered anyways. So yeah, they said my pump will be here in 7 to 10 days. So we'll see how that all works out, because my insurance said you should order it, that it's covered like 30 days before your due date. But they told me to call now because they said there are a waiting list everywhere, and I called and then they were like, it'll be there in 7 to 10 days. And I'm like, okay, I hope it's covered, because if it's not, they'll contact me if it's not, but then I'll have to reorder it in a few months. But I just did what my insurance said, call ahead, so I'll let you know when I get that, and I'll show it to you. Okay, so kind of on the same breastfeeding note, I got my Boppy pillows out and I machine washed them, and they washed up great. And we don't use dryer sheets at our house, we use wool dryer balls. So I just threw those in the dryer, and it helped kind of fluff the pillows back up. I have 2 Boppies, one for the nursery and one for like our family room area where I do all of the nursing. And I had girly covers on the Boppies because of Annabelle. So I wanted Boppy covers, and I wanted Minky ones that are like really soft and nice because I spent a lot of time with these pillows. Okay, so I went to the stores and everything, and the Minky ones aren't that cheap, and so I went on Etsy to see, what they offered, and I found this one shop, and it's called I Sew Joe. So let me tell you, it's the letter I, SEWJO. And this one cost $29. In the store, I think they're about like $25. So you can get a custom one for $29, and it got here super quick, like less than a week. So I'm going to show you the one that I got. So this is it. It's Minky on this side, and then it's Minky on this side. And then I like ones with zippers and not the kinds that are like pillow shams. This one has an invisible zipper along the seam here. So if you're nursing, like this, you can use either side. There's no zipper buttons or anything in the baby's way. I already washed it. It came out of the washer perfect. It fits the Boppy perfect. I really want to order another one for my other Boppy. So maybe I will. I don't know. I wanted just to order one and see how it was, and shipping was like really reasonable. It was $29 total. So I really like it. So I thought I'd pass it along for anyone who wants to match a Boppy to a nursery or wants something soft. Because even the ones that you buy like at the store, they're not minky on both sides. Like this side would be regular fabric and this side would be minky. Or they have like, I think they have a plain like royal blue one that's minky on both sides and like $12 or $13. But that's not cute. And I know cute is not like so important, but I really like this boppy, and I like where the zipper is, the cover. So I thought I would pass that along. So I think that's it for this week. I'm going to show you my belly. I've gained some weight. 18.6 pounds I've gained at 22 weeks in one day. So baby's a pound of that weight, but you know, that's not much. So I will show you my belly. I feel like the shape of my belly changed since the baby flipped. And I've also been running my belly into things like this past week, like 2 or 3 times I've like just run into things because I'm not used to having this belly. Like it's been a while since I've had a belly, so I need to adjust my footing to make sure I stop in time for my belly to like not run into things. So that's been a challenge this week. Now I'm like kind of walk like with my hand over my belly so that I don't run into things, because that's no fun. Alright, here's the 22-week belly. Yeah, I think the shape changed. I don't know. What do you guys think? There's a belly. So my belly button is not popped out. It hasn't popped out in any pregnancy yet, so we'll see. I think that's it for this week. I will see you ladies next week. I will update you on anything my OB says when they call today about reading that ultrasound. And I don't think I have anything scheduled next week for the baby. Following week I have an OB appointment and more blood work and stuff, but that's that, I think. Alright, I will see you ladies next week. Thanks for watching. Bye!